Now, when it comes to treatment, everything really hangs on one big question. Has a bleed from those varices happened yet? If the answer is no, then the goal is all about prevention. It's called primary prophylaxis, doing everything you can to stop that first potentially deadly bleed. But if a bleed has already happened, the goal shifts to making sure it never ever happens again. That's secondary prophylaxis.
So, what's in the toolkit to control this flood? Well, the first line of defense is often medication, specifically beta blockers. They help lower the overall pressure in the whole system. To deal with the varices head-on, doctors can do a procedure called banding, where they put tiny little rubber bands on them to basically choke off their blood supply. And for all that fluid buildup, the ascites, the go-to, is usually diuretics or water pills, and cutting way back on salt. But sometimes that's not enough. And when that happens, there's a more advanced procedure called TIPS. The best way to think of this is like building an engineered bypass channel to get around the dam. A specialist places a stent that creates a whole new path for blood, letting it flow from the high-pressure portal vein directly to a low-pressure vein, completely bypassing the scarred liver. The pressure drops almost immediately. But after all of this, all the medications, the procedures, the incredible ways we have to manage the flood, we're left with a pretty sobering reality. For portal hypertension that's caused by a failing liver, all these strategies are just managing the symptoms. The only real cure, the only way to fix the source of the problem, is to replace the failing organ with a liver transplant.